Bismillahirrahmanirrahim. Today's second talk is a very short talk about cervical incompetence. We will discuss about evaluation of cervix in pregnancy. By definition, the cervical incompetence is a condition in which the cervix begins to open, which is dilate, and thin, which is efface, before the pregnancy has reached term. As we know, at term, the cervix will begin to open to allow us to have delivery, whereas if it happens before term, it will cause problems and it can result in preterm delivery or in abortion. Occurring in the second or third trimester, cervical incompetence is a cause of late miscarriage and premature birth. When a cervix is incompetent, the muscle of the cervix is weak and the pressure of the growing baby causes the weak cervix to open. Cervical incompetence occurs in only 1 to 2% of all pregnancies. It is the cause of 20 to 25% of miscarriages in the second trimester. It is thought to be due to either an inherent congenital weakness of the cervix tissues. Congenital weakness can occur unexpectedly, result of exposure to DES is diethylstilbestrol before birth. Result of forced dilatation of cervix and trauma. The risk factors are previous surgical procedures involving the cervix, including a DNC or a biopsy, malformation of the cervix, maternal exposure to DES while in utero, damage to the cervix during a prior difficult delivery, and multiple gestation. If a woman is known to have a weak cervix, usually because of a problem in a prior pregnancy, measures can be taken to reduce the risk of miscarriage or premature birth in subsequent pregnancies. Signs and symptoms are vaginal bleeding or spotting, pressure or heaviness in the lower abdomen. The diagnosis is through transvaginal ultrasound. During pregnancy, it has shown very good results. The usual length of the cervix is about 4 cm as measured on TVS. Women with a cervical length of less than 2.5 cm have been found to have a 50% risk of preterm delivery. Opening of the internal section of the cervix, which is called funneling or beaking, in response to pressure on the top of the cervix. For cervical incompetence, TVS or translabial ultrasound has got 83% accuracy as compared to 76% accuracy of transabdominal scan. But always we must have cervical serial scans which are more helpful. Measurement of cervix, if we go in details, from 12 to 16 weeks, in primigravida it is 42 mm. and multipara is 40 mm. This is when we include the internal external losses. So it is outer to outer. Small anechoic line due to mucus in cervix is normal. We can use transabdominal, translabial and transvaginal routes. First is in transabdominal sonography. Here is the cervix. You can see the cervix in transabdominal ultrasound, but if the bladder is over distended, it can compress and elongate, so the results will be difficult. Here it is again vagina and this is cervix. So if it is compressed by full bladder, we will get the wrong results. There is another cervix by transabdominal scan, external loss. This is internal loss, the cervical canal, anterior lip and posterior lip and a gravid uterus. Fetal head which is fixed with internal os, this is cervix. So we can measure the length of cervix. Then is translabial sonography. We use probe which is 3.5 megahertz. Use a small plastic bag as probe cover. Put small amount of gel in the cover. Cover the probe. Secure the cover with rubber band. Apply gel outside the cover. Use disposable gloves during examination, and bladder should be partially filled. Place the probe between labia in sagittal plane. We are using the probe which is used for transabdominal scanning. Visualize vaginal stripe parallel to beam and cervix perpendicular to beam. Here is the vaginal stripe and then is cervix. Urinary bladder, this is fetal head. Translabial scan, if we rotate it, this is vagina, and then we can get the cervix. We can easily measure the cervix. Here is vagina, the external os and internal os. So very easy to measure, and it has got high accuracy, which is about 83%. This is how we measure the cervix, from external os to the internal os. We can compare the translabial with transabdominal. This is translabial scanning. We can measure cervix, and transabdominal scanning. Another case of translabial.